Abdominal aortic aneurysm, commonly known as AAA, is a potentially life-threatening condition that occurs when a section of the abdominal aorta, the main blood vessel supplying blood to the lower half of the body, becomes weakened and enlarges. If left undetected, an AAA can silently grow over time, eventually leading to a dangerous rupture or bleeding that can have fatal consequences. However, with the advancement of medical technology and awareness, there are effective ways to avoid the devastating outcomes of abdominal bleeding or rupture through timely screening and intervention. Understanding what an abdominal aortic aneurysm is forms the foundation of prevention. The aorta is the largest artery in the body, running from the heart down through the chest and abdomen. An aneurysm refers to a balloon-like bulge that forms in a weakened area of this blood vessel. Most BCAs develop slowly over years and may not cause any symptoms until they become large or rupture. When rupture occurs, it leads to massive internal bleeding, which is a medical emergency with a high risk of death. This silent progression is what makes screening so critical. The primary goal of AAA screening is early detection. By identifying an aneurysm before it ruptures, individuals can receive monitoring and appropriate treatment to prevent complications. Screening is especially important because most AAAs are asymptomatic, meaning they do not present any warning signs until they reach a dangerous size or rupture. This is why proactive screening can be a lifesaver. So, who should consider AAA screening? The risk of developing an abdominal aortic aneurysm is influenced by several factors. Age is a significant factor, with most cases occurring in individuals aged 65 and older. Men are at a higher risk than women, and the risk increases with a family history of CAA. Smoking is the most important modifiable risk factor as it significantly weakens the aortic wall over time. High blood pressure, high cholesterol, and a history of vascular disease also contribute to the likelihood of developing an aneurysm. Given these risk factors, many health organizations recommend a one-time screening for AA in men aged 65 to 75 who have ever smoked. Some guidelines also suggest screening for men in this age group even if they have never smoked, particularly if they have a family history of aneurysms. While the risk for women is lower, those with a strong family history or other risk factors may also benefit from screening. It is important to discuss your individual risk profile with your healthcare provider to determine the best approach. The screening process for AAA is simple, safe, and non-invasive. It typically involves an abdominal ultrasound, which uses sound waves to create an image of the aorta and measure its diameter. The procedure is painless and takes only a few minutes. If the ultrasound shows that the aorta is normal in size, no further testing may be needed. If an aneurysm is detected, the size and location will guide further management. The results of AA screening are typically categorized based on the size of the aneurysm. If the diameter of the aorta is less than 3 centimeters, it is considered normal and no intervention is necessary. If the diameter is between 3 and 5.4 centimeters, the aneurysm is considered small to medium, and regular surveillance, usually with periodic ultrasounds, is recommended to monitor for growth. When the diameter reaches 5.5 centimeters or more, the risk of rupture increases significantly, and surgical repair may be advised. By identifying an aneurysm early, before it reaches a critical size, individuals can work with their healthcare team to develop a plan that minimizes the risk of rupture. Regular monitoring allows doctors to track the growth of the aneurysm and intervene at the optimal time, thus preventing emergency situations. In some cases, lifestyle changes such as quitting smoking, managing blood pressure and cholesterol, maintaining a healthy weight, and exercising regularly can help slow aneurysm growth and improve overall vascular health. For those whose aneurysms reach a size that warrants intervention, there are two main treatment options: open surgical repair and endovascular aneurysm repair, or EVAR. Open surgical repair involves removing the weakened section of the aorta and replacing it with a synthetic graft. EVAR, on the other hand, is a minimally invasive procedure in which a stent graft is inserted through small incisions in the groin and guided into place within the aneurysm. Both approaches have their own risks and benefits, and the choice depends on the patient's overall health, aneurysm anatomy, and preferences. The importance of AAA screening cannot be overstated. Studies have shown that screening programs can significantly reduce the incidence of aneurysm-related deaths by identifying aneurysms before they rupture and enabling timely treatment. In countries where screening has been widely implemented, there has been a notable decline in deaths from ruptured AAAs. This highlights the power of prevention and the value of being proactive about vascular health. Avoiding the catastrophic consequences of abdominal bleeding or rupture starts with awareness. Understanding your personal risk factors, engaging in healthy lifestyle practices, and seeking regular medical care are essential steps. If you fall into a higher risk category, do not hesitate to ask your healthcare provider about AAA screening. Early detection through screening is the most effective way to prevent rupture and ensure a longer, healthier life. In addition to personal action, public health efforts play a role in reducing the burden of CAA. Encouraging at-risk populations to participate in screening programs, raising awareness about the dangers of undiagnosed aneurysms, and promoting smoking cessation can all help decrease the incidence of rupture and bleeding. Ultimately, abdominal aortic aneurysm screening serves as a powerful tool to avoid the silent threat of abdominal bleeding or rupture. By taking advantage of this simple, painless test, individuals can safeguard their health, gain peace of mind, and take control of their future. Remember, the key to preventing tragedy lies in early detection and timely intervention. If you or your loved ones are in the recommended age group or have risk factors for AAA, consider scheduling a screening. Because when it comes to aneurysms, what you don't know truly can hurt you. Empower yourself with knowledge, take action, and protect your life from the hidden dangers within. To learn more, go to kbfitnesshealth.com.